Opportunities for Ohioans with Disabilities, Disability Etiquette Training.
Good morning and welcome to today's Opportunities for Ohioans with Disabilities presentation of Disability Etiquette. In January 2019, Ohio Governor Mike DeWine signed an executive order establishing Ohio as a disability inclusion state and model employer of individuals with disabilities. That order included a directive that all state employees participate in regular disability etiquette and awareness training. Today's presentation is a modified version of a training that was originally developed for state employees. You will get to hear firsthand accounts about respectful interactions from people with disabilities. My name is Ron Klanowski, and I am the Business Relations Specialist for OOD's East Central Region. Prior to taking on this role, I served as the Executive Director for the ARC of Stark County for 12 years. The ARC is an advocacy agency for people with developmental disabilities. My biggest influence on my career path, however, was not my past employment, but the fact that I have a 24-year-old son who has autism. I am excited to be co-presenting with my fellow Business Relations Specialist, Jill Simpson. We have some great information to share with you, and this training couldn't come at a better time as we are celebrating the 30th anniversary of the signing of the Americans with Disabilities Act, or ADA, on July 26th. This landmark piece of legislation helps to ensure individuals with disabilities have equal opportunity to work and participate in all aspects of society and prohibits disability discrimination. And today's training can be helpful in meeting the tenets of the ADA by addressing appropriate language and respectful interactions with people with disabilities, all in an effort to assure equality. Today's presentation will be a back and forth conversation between Jill Simpson and me. Jill, would you like to introduce yourself?
Thank you, Ron, and good morning to everyone who has joined us. As mentioned before, I am the Business Relations Specialist for OOD's Northwest region and have been with Opportunities for Ohioans with Disabilities since September 2019. Prior to joining OOD, I earned a master's degree in business administration and served as the CEO and president of the Chamber of Commerce of Sandusky County. I also hold over 20 years of management experience working with organizations that include the Sandusky County Board of Developmental Disabilities and Easter Seals of Northwest Ohio. And I'm very pleased to be with you today.
As some of you may not be familiar with OOD, I'd like to provide a brief explanation of our agency. OOD is Ohio's vocational rehabilitation agency, and it exists to help individuals with disabilities find competitive and integrated employment in the community. Simultaneously, we serve employers as they look to diversify their workforce with qualified employees. The individuals we serve have two things in common: a disability they feel presents a barrier to gaining employment and a desire to work. They work with an OOD vocational rehabilitation counselor who provides the services they need to get or keep a job. Our agency partners with a network of provider agencies who employ staff like job developers and job coaches to help a person get a job and be successful at work. Jill and I, along with our fellow BRSs, Cynthia Cruz in the Southwest, Kelly Jordan in the Southeast, and Mike Hogue in the Northeast, form strategic partnerships with employers to help them fulfill their hiring needs. We learn as much as we can about the company and their job openings. That information is shared with our talent sourcing coordinators, who in turn work with our vocational rehabilitation counselors to identify appropriate applicants from their caseload. In addition to sourcing job candidates to our employee partners, we provide many other services to businesses, including disability awareness training, such as today's presentation. Jill, can you talk a little bit about what we will be covering today?
Sure. So this training is designed for managers and employees to support diversity and inclusion in the workplace. but should also be helpful to everyone during their everyday lives. As people with disabilities are not only our customers and colleagues, but they are oftentimes our family members, friends, and community members. So 3 things we are going to cover in this presentation are the definition of a disability and some common types, terminology that is considered appropriate, and we'll also share what could be offensive. And finally, we're going to share some best practices with you for interacting respectfully with people with disabilities, as we want you to feel comfortable and confident during your interactions. Let's start by sharing, excuse me, what a disability is. People with disabilities make up the largest minority group in the country. In fact, statistics show that 1 in 4 Americans will acquire a disability at some point in their lifetime. The ADA defines an individual with a disability as either a person who has a physical or mental health impairment that substantially limits 1 or more of their major life activities. And those activities would include a person's ability to see, hear, walk, caring for oneself, learn, think, and communicate. The ADA also defines an individual with a disability as someone who has a history or record of such an impairment, or a person who is perceived by others as having such an impairment. Let's look at this picture, obviously taken before the pandemic. I'd like you to consider each of these individuals and decide which of them has a disability. How many of them would you guess has a disability? The answer is that the number of people with a disability is unknown. Most of you probably noticed the woman who uses a wheelchair, and some of you may have noted that a man is wearing glasses. But when it comes to disabilities, most of them are invisible. Invisible disabilities are those disabilities that are not immediately apparent. Whereas you can see a person who uses a wheelchair due to a physical disability, or someone who is using a cane because they are blind, you may not know if a person has a disability such as chronic fatigue syndrome, epilepsy, diabetes, attention deficit disorder, or even traumatic brain injury. Other examples of invisible disabilities can include learning disabilities such as dyslexia, and mental health disabilities such as anxiety, depression, and post-traumatic stress or bipolar disorder. It's estimated that 10% of the US population has a medical condition which could be considered a type of invisible disability. Now, employees are not required to disclose a disability at work, and since many of those disabilities are not visible, it's very likely that each of us are already working with people with disabilities. So what are the rules for disability etiquette? It's simple. Behave in the same courteous and respectful manner with a person with a disability as you would with anyone else. Most importantly, concentrate on the individual and not on the disability. The more you do that, the less significant the disability really does become. Ron, at this point, could you spend some time talking about respectful interactions with people who have physical disabilities or use a wheelchair?
Sure, Jill. But first, let's talk about the many reasons an individual may have a physical disability. These types of disabilities can be caused by a car accident, a stroke, severe arthritis, military injury, or a condition from birth like cerebral palsy, just to name a few. Physical disabilities affect a person's coordination, sensation, or their ability to move. When you interact with someone who has a physical disability, it's important to treat them as you would anyone else. For example, although it's recommended not to shake hands right now because of the pandemic, if or when this custom resumes, if a person has a prosthetic hand, you would shake their hand as you would with anyone else. Use your left hand to shake hands with someone that does not have a right hand. If someone is unable to shake hands, you can gently touch that individual on their arm during your introduction. If a person has a cosmetic disfigurement, it's important to maintain eye contact with that person. If this is an issue for you, you can focus on their forehead, which will still give the illusion of direct eye contact. If a person doesn't appear to show interest or excitement, keep in mind that person may be very motivated and capable. It may simply be a result of their disability. This can be due to a neurological condition, a developmental disability, or it may be a side effect of a prescription drug. Before we move on to discuss respectful interactions with a person who uses a wheelchair, let's hear from Jacqueline.
Important to let somebody in a wheelchair take on the wheeling themselves, because that's their way of moving in the environment. So if you take control and just do it on your own, then you're taking that away from them. So definitely do not grab somebody by the back of the wheelchair and start pushing them without either asking them first or them asking for your assistance. You're speaking with somebody and they're standing, it can be a little awkward. If it's a long conversation, it's nice when people can actually sit down and be able to sit and talk at eye height with me. But if it's something brief, saying hello, that's perfectly fine. But leaning in, depending on the circumstances, it can be kind of demeaning.
Jacqueline makes some great points. Let's go over some of the items she spoke about when interacting with someone who uses a wheelchair. Maintaining eye contact is an important part of our culture, and you may question how to maintain eye contact with someone who is seated in a wheelchair. There are a couple of quick rules of thumb to remember. If the conversation is going to be brief, such as a greeting or a quick hello, it is okay to remain standing. If the conversation is going to be of some length, such as an interview, performance evaluation, or brainstorming session, you will want to sit down so that you are at the same eye level. What you don't want to do is lean down in front of the person in a wheelchair, as this is often how we talk to children, and it can be perceived as demeaning. For people who utilize a wheelchair for mobility, it's important that you do not lean on the wheelchair. Think of the wheelchair as an extension of the person. Just as you would not lean on someone's shoulder while you're talking with them, you should not lean or rest your foot on a person's wheelchair. As Jacqueline mentioned, a wheelchair is a mobility device that the person uses to maintain their independence. If you would like to help someone in a wheelchair move locations, please do not automatically push the wheelchair. Rather, you can offer assistance by simply asking the person who uses the wheelchair, "Would you like some help getting to the conference room?" and then wait for the person's response. Avoid leaning over a person's wheelchair when you're having a conversation or when shaking hands with others. This is an invasion of their personal space and can really be uncomfortable for the person using a wheelchair. It's okay to use phrases such as, "Let's walk over to the whiteboard," or "She's running late." These are common phrases in our vernacular and are not considered offensive. And it's always important to keep accessibility in mind, not just for that person's work area, but for any part of your business they will utilize. Restrooms, break rooms, the parking lot, and meeting areas are some examples. Now let's take a look at some acceptable terminology and terms that you want to avoid. Avoid words and phrases with a negative connotation. Terms like crippled are offensive. If it is necessary to address that a person has a physical disability, for example, simply say person with a disability or person who uses a wheelchair. Similarly, using words like normal or able-bodied indicate there is something wrong with the person who has a physical disability. Instead, use the term person without a disability. Again, avoid the term crippled. An alternative might be walks with crutches. Use person of short stature versus midget or dwarf. You may hear people say that someone is confined or bound to a wheelchair. Being bound or confined indicates an inability to move. Actually, it's quite the reverse. A person uses a wheelchair to be able to move around in their environment. Two very common terms that are outdated are special seating and handicap parking. Instead, use the word accessible. All right, Jill, let's hear a little bit about respectful interaction with people who have mental health disabilities.
Thanks, Ron. Because mental health disabilities are typically invisible disabilities, they are often less understood. Some things to keep in mind are they are real health conditions, just like cancer, diabetes, or heart disease. There are a wide range of mental health disabilities. They can occur at any stage of life to anyone, and the symptoms vary from person to person. Some examples of mental health disabilities are depression, bipolar disorder, anxiety, and schizophrenia, but there are many others. Remember to treat people with mental health disabilities as you would want to be treated yourself. Don't patronize, condescend, or make decisions for someone with a mental health disability. Avoid making assumptions about the person's wants, likes, or needs. And if you're aware of a person's mental health disability, never disclose this without asking the person for permission first. There are many different types of mental health diagnoses, and each person is affected differently. Please avoid blaming the person. A person with a mental health disability can't just snap out of it, and it would be insensitive and ineffective to tell the person to do so. And finally, focus on the person instead of the mental health disability.
Jill, I work with a supervisor of a company who said that one of his team members came to him with concerns about a coworker who seemed to be quieter and more withdrawn lately. She also noticed the coworker has been absent more often and that she's making mistakes at work. She is worried something's wrong. The coworker had already shared with the supervisor that she has depression and asked for flexibility in her schedule to get treatment. The supervisor told me that he appreciates the team member coming in with concerns about her coworker and encourages his team members to take care of each other. Should the supervisor go ahead and tell this team member not to worry about her coworker since she already knows she's getting help with the depression?
First, let me say it's great to hear that this company values a culture of looking out for each other and that the supervisor maintains an open door policy. In this situation, I think it's important that the supervisor acknowledges his team members' concerns while also respecting the privacy of the coworker. The decision to disclose a disability belongs to the coworker dealing with depression. Although she disclosed her disability to her supervisor when she requested a reasonable accommodation, which was the flexibility in her work schedule, it does not mean that she wishes for her disability to be disclosed to other team members. I would suggest that the supervisor thank the team member for coming to him with her concerns and encourage her to continue to offer support to her coworker. The team member could say something like, "I noticed you haven't been yourself lately and wanted to know if there's anything I can do to help." I would also suggest that the supervisor be mindful of a few things in his own interactions with the employee dealing with depression. For example, he'll want to be careful not to assume that every time this employee doesn't seem to be herself, that it's related to depression. As we all know, everyone has a bad day once in a while. It's also important not to ask the employee if she has taken her medication. And lastly, the supervisor will want to treat the employee with empathy instead of sympathy and extend courtesy, understanding, and patience rather than pity. Along that same line, let's also be mindful of the respectful way to refer to a person with a mental health disability. Terms like disturbed, crazy, and insane can be hurtful and insulting. A better alternative would be person with a mental health disability. Okay, let's pause here and check to see if we have any questions before we move on to our next topic.
Good morning, Ron and Jill. We do have some questions. The first one is, if my company wants to hire someone who uses a wheelchair, but certain parts of our building are not accessible, are there funding options available to help pay for those changes?
I'll take this one, Jill.
Okay.
There are tax benefits for employers committed to reducing barriers to employment for people with disabilities. Examples include the architectural barrier removal tax deduction and the disability access credit, which can help with projects like widening doors, building ramps, making materials accessible, and modifying equipment and vehicles.
Another question we received is, what if I'm not comfortable using common language, like saying I've got to run around someone who uses a wheelchair?
The information we are sharing today is just to let you know it is acceptable to use those common phrases, but there's no need to use them if you're not comfortable doing so. Another phrase they might consider is to say, I've got to go.
Thank you. The next question is, are people with disabilities more likely to have an accident at work than those that do not have disabilities?
I can take this one. No. Actually, a study was published by the American Society of Safety Professionals that showed that people with disabilities are not less likely to be involved in an accident, or are not only less likely to be involved in an accident than those in the general population, but they are also 48% less likely to be involved in the turnover rate.
Thank you. And the last question we have, as a manager, if I have someone on my team who I know has a mental health disability and I become concerned about their well-being, how should I handle that?
So in this case, it depends on what you mean by who I know has a mental health disability. Did the team member disclose this, or are you basing it on the observation of the person? That will have an impact on how you discuss the issue. In either case, though, it's best to simply reach out to the employee, mention that you've noticed some changes in work performance or behavior, and offer to help without specifically mentioning that you think it's related to a disability. That gives the employee the option of discussing the disability.
Great. Thank you, Jill and Ron. That is it for the questions right now.
Okay. Next, we're going to talk about disability etiquette when interacting with a person who has a visual disability. Let's start with a few things to keep in mind about the different types of visual disabilities. Not everyone with a visual disability is totally blind. Many have some usable sight. The term legally blind is used when a person has 10% or less of their vision. So again, they can still have some vision and be legally blind. Blindness or low vision can be caused by an injury or various conditions and diseases such as macular degeneration or glaucoma, and may occur at birth or be progressive and get worse over time. Let's take a moment now to hear from Jeff, a person who is blind, regarding disability etiquette.
I'm just like you. in a lot of ways. There are many more ways that we are similar than that we are not. And so I remember when I went into classrooms, one of the most common questions was, well, so what was it like adjusting to going to college with your disability? Was it like learning how to read all the textbooks and to get around the campus? And I said, well, you know, not really. Those are things that I've lived with my disability my whole life. The hardest part about going to college for me was doing my own laundry and getting up on time because mom wasn't there anymore. I think it is very okay to ask me questions, and actually I would prefer that. If people are unsure of how to interact with me, asking questions is the best answer, because I'm probably the only one that really knows the best way to interact with me.
Here are some additional tips when working with someone who is blind or has low vision. When approaching the person, immediately identify yourself. You can say something like, "Hi, my name is Jill. It's nice to meet you." If shaking hands is appropriate, you can say something like, "May I shake your hand?" And this will let the person know to extend their hand for you to take. Of course, you will also want to let the person know when you are stepping away, as the person may not always have the visual cue that you have left their space. And there is no need to be embarrassed when using phrases such as, "Do you see what I mean?" or "Did you watch the game last night?" That's considered perfectly acceptable conversation. There is no need to shout. It will not help someone blind see you any better. Believe it or not, this is something that happens frequently to people who are blind. Okay, let's say you and a colleague are attending a conference and are supposed to go to a meeting room on another floor of the building. Your colleague is blind and you want to be helpful. What should you do? Many people have the misconception that you would take your colleague by the arm and pull her in the direction she needs to go. Yet it is the exact opposite. Should your colleague want your assistance, you would offer your arm to her. So first of all, you'll want to ask, "Would you like assistance to the meeting room?" If she responds yes, then you can touch the back of your hand to the back of her hand. This will allow your colleague to slide her hand up to your elbow, or if she prefers, your shoulder. Once her hand is in place, you can begin walking and alerting her to any obstacles that may be a potential hazard, such as stairs or an extension cord on the floor. When you reach the meeting room, place your colleague's hand on the back of a chair for her to sit in and let her know, and she will take it from there. You'll also want to alert her if the chair has wheels, at which time you can also offer to hold the chair while she takes a seat. Please keep doors and cabinets either open or closed. Partially open doors and drawers are a hazard. People who are blind or have low vision may use devices such as a cane or service dog to help them navigate the environment. Think of the cane as an extension of the individual. You will want to refrain from touching or moving the cane. If you need the cane to be relocated, simply ask the person. Let's talk about service dogs for a moment. Service dogs for the blind are trained to perform specific tasks for the person. These dogs go through about 18 to 24 months of training. The dog is trained that when the harness goes over their head, they are on duty and expected to perform those trained tasks. If you pet the dog, offer it a treat, or call its name while the dog is wearing the harness, you risk confusing the dog and could essentially begin to undo the training, which puts the person with the disability at risk. You have to remember these dogs are not there for our entertainment. These dogs have a very important job to do of helping our colleagues navigate the workplace. Let's hear more about this from Katie, an employee who is blind.
If you do see a person who is blind and they're traveling with a guide dog or a white cane, please don't touch those devices unless the person gives you permission to do so. We all love dogs, but they're doing really important work, and so the person who needs the dog is really a team effort to work with the dog, and so that the person who's using the dog is really relying on the dog to keep them safe.
As we've done throughout our discussion today, let's look at some terminology, do's and don'ts. Remember, we don't want to identify a person by their disability. Don't refer to people with visual disabilities as the blind or the sightless. Instead, use people first language by saying a person who is blind. Ron, can you talk next about how to respectfully interact with people who have an intellectual or developmental disability, such as Down syndrome or autism?
Sure, I'd be glad to, Jill. When you are aware that a person has an intellectual or developmental disability, we have a few tips to improve communication. Both intellectual and developmental disabilities are usually present at birth and impact an individual's physical, intellectual, and/or emotional development. Intellectual disabilities affect intellectual functioning and adaptive behavior, including everyday social and life skills. Adaptive behavior is how well a person is able to thrive in their environment while being able to interact with people. Developmental disabilities is a broader category of often lifelong disabilities that can be intellectual, physical, or both. Some examples of developmental disabilities include cerebral palsy, Down syndrome, and autism spectrum disorder. Autism spectrum disorder is a developmental disability that affects how a person interacts and communicates with others. Some people with autism are very literal. As a spectrum disorder, there is a variance in functionality. People who have autism experience and display a wide range of behaviors and symptoms. As I mentioned at the beginning of our presentation, my adult son has autism. He is very intelligent. He struggles more with his social skills. Let's take a moment now to hear from Connor, a person who has autism, regarding disability etiquette.
People think autism tends to have like a one symptom, but it's not. I mean, it's a variety. Like some people with autism have certain behaviors and others don't. One of the things I do is like hand flapping or like reciting words and phrases that I hear on like TV or something, which basically leads to like why people with autism tend to have trouble communicating is social awkwardness. I've been in so many situations where I mean, I don't mean to come off in the wrong manner, but people take it the wrong way because it's just something I do. It's just how my brain processes. I can't control it. That's another thing with autism is not being able to understand other people's emotions. If you look at a pond and you see a line of ducks just swimming across, they may seem like they're going really, really slow, very smooth, but underneath that water, they are kicking them web feet as hard as they can. That's kind of like what goes on the inside of me. So people don't see what goes on. They judge me based on like how I act or like what I say and stuff instead of like getting to know who I really am. And that's been a really tough part about my life with communicating with people. One of the toughest things that people would say to me is that they call me retarded, which infuriated me because like people thought that I was below human, like I was being treated kind of like a robot. Like I can't understand emotions like humans can. Like robots can't love, or they can't understand emotions and stuff, and that's what people viewed me like. When I was younger, my neighbors and I used to hang out. We would go swimming in our pool. So I one time asked them, I was like, "Hey, you want to come swim?" It's like, "Yeah, sure." So they were walking into the house. They never came back, and I stood there for a long time. I fall for what people say. It's one of my weaknesses with communication. I would say the best way for a person to communicate with a person with autism is to get to know like what they like and like how they act and then like sort of come down to their level. If you get like an attitude or something, or you do something like if you touch them or something, they overreact like, what are you doing? So you got to make sure like how your that your communication skills are at the same level as they are, so or else it's not going to go so well. The way my boss and I can communicate is by phone. Like when I look at it and stuff, I'm like, oh, okay, so that way I can do this and that. You got to have it like written down or like on a screen and stuff, so that way I can better process it. Please do not call them retarded, please, because people use that all the time, and it infuriates them. It's like it's basically, I take it like it's offense to my intelligence, to my abilities to do things like others. They think I can't do these things. So I feel like people need to get to know a person with autism before jumping to conclusions. You'll find that they can do a lot of things that people without autism can't do.
As Connor mentioned, autism spectrum disorder is called a spectrum because there could be a wide range of types and symptoms of autism. Here are some tips for communicating with people with autism. Always presume competence. Talk to the person, not about the person. Just because someone may have challenges with communicating does not mean they cannot understand what you are saying. All individuals with autism have their own personality, just as anyone else does. Some on the spectrum display little emotion, but they are still unique individuals. Look past the physical symptoms and behaviors and see that unique person inside. Many individuals with autism, my son included, display repetitive behavior. So if you work with someone who has autism, you may see them doing or saying the same things repeatedly. In my son's case, he will ask the same question frequently, but the repetitive behavior could be physical rather than verbal. Ignore repetitive behaviors just as you would ignore someone twirling their hair with their fingers. Don't take it personally if a person with autism responds to you bluntly or makes a frank comment. Respond in a straightforward manner that explains why the response was inappropriate and guide them to a more appropriate response. When interacting with a person with an intellectual or developmental disability, you will want to be direct with your questions. Sometimes subtleties can be difficult for the person. It is important that you are patient and give the person time to respond. Remain comfortable with the break in conversation. Intellectual or developmental disabilities can affect a person's processing of information. It may take the person a little bit longer to process what you have said and formulate their response. If you are asked to repeat a question, you can try to explain it in a different way or provide an example. For some people with intellectual or developmental disabilities, providing information in the form of pictures can enhance their understanding.
So Ron, I recently had a question from an employer that has an employee with autism. The employee has been working for the company for over a year and is doing very well. He has a good relationship with his supervisor who understands that he likes routine and consistency. However, his supervisor is being promoted and will soon be leaving the employee's department. The employer is concerned that this type of change might cause some behavioral issues, such as an outburst and a loss of productivity. What could the employer do to help prepare for this?
Well, Jill, it's great that the supervisor took the time to understand her employee and build a strong relationship. I'm sure this would contribute to the success of this employee. One thing to remember when working with people with disabilities is not to assume. While this employee may be upset to be losing such a great supervisor, potential outbursts and loss of productivity may be avoided or diminished depending on how the transition from one supervisor to the next is handled. Maintaining an open channel of communication between the employee, the former supervisor, and the new supervisor can support a smooth transition. Looking again at some do's and don'ts. Don't say cerebral palsy victim or spastic. Using the term victim has a negative connotation that something wrong has been done to the person. Saying that a person is spastic is defining them by a symptom that they may have. Instead, simply use the term person who has cerebral palsy. It's appropriate to use person-first language such as person with epilepsy or seizure disorder, rather than calling the person an epileptic. By doing that, you are defining that person only by their disability. Mental retardation was originally a non-offensive term that, through the use of the R word, has become offensive and hurtful to people with intellectual and developmental disabilities. In fact, in 2010, through the work of individuals with intellectual and developmental disabilities and advocates, a law was passed eliminating the reference to mental retardation in all federal law. So when speaking of someone with intellectual or developmental disabilities, use person-first language along with their particular disability. For example, a person with a learning disability or a person with Down syndrome instead of the R word. Some people with cerebral palsy or Down syndrome may also have a speech disability. Use person-first language rather than saying speech impaired, which implies the person has something wrong with them. Before we move on, do we have any more questions?
We do have questions. Let me find the first one. The question is it not okay to say other abled versus disabled?
I'm sorry, can you repeat that question?
Yes. Is it not okay to say other abled versus disabled?
I think it's preferable to focus on the person whenever you have an opportunity to. So other able is certainly better than disabled, but I would use the person first language is probably the best way to go about it. Jill, do you have anything to add to that?
No, I think that's a good response, Ron.
Thank you. The next question, can a company get funding for a hearing loop to be installed in a room or cafe for meetings to make it easier on a person with hearing impairment?
Do you want me to take that?
I'm sorry.
I'll take that one.
Okay.
I think we mentioned before that there are some tax incentives for companies that make their place of employment more accessible to people with disabilities. So there may be some benefits there. As the BRSs, Ron and I and our colleagues can help with that information and get some resources out to you. So if you want to leave your name and contact information, we can reach out to you after this presentation.
Great, thank you. The next question, are there program opportunities through the state for hiring those with a disability?
Well, Opportunities for Ohioans with Disabilities is a way to work for people who have disabilities. So partnering with us, all the BRSs throughout the state can help businesses diversify by hiring people with disabilities.
Great, thank you. The next question. Our occupational therapist just attended a 4-day training from Star Institute on autism sensory, where they shared that the term autistic person is becoming preferred to person with autism. Is this in fact a trend within the autism community?
Well, actually, we're going to hold on to that question because that's going to be covered a little bit later in the presentation.
Okay, great. One more question. Does the state offer internal audits or inspections to see if an office space is accessible to those with physical disabilities?
We do have a worksite accessibility specialist that will work with businesses to look at their office space and offer suggestions to make it more accessible to people with disabilities. That's a no-cost service to businesses in Ohio. And again, if you want to contact Ron or I, we can put you in contact with Julie Wood.
Great, thank you. One more question. If an employee requests a change to their job or the work environment, but does not disclose a disability, What's the best way to approach that?
Well, obviously, anytime you have a situation like this, the best thing to do is have a discussion. If the employee hasn't disclosed that they have a disability, it's not recommended to bring that up. Simply talk to them about why they're asking for these changes. And then if the individual chooses to disclose that, then you can have more of an in-depth conversation on that particular issue.
Great. Thank you, Ron and Jill. That's it for questions right now.
All right, thanks everybody for those questions. Now let's talk about interacting with people with hearing disabilities and how we and our fellow employees can respectfully communicate with people who they work alongside who may be deaf or hard of hearing. The first thing to take note of is the correct terminology when referring to someone who has hearing loss is deaf or hard of hearing, not hearing impaired. The majority of people in this group do not see themselves as impaired, and by having that in the title, it implies there is something wrong with them. Deaf people who use sign language consider themselves a cultural and linguistic minority. The term hearing disabilities covers a wide range of hearing loss, from partial to total. Hearing loss can be caused by various diseases or injuries, including viral infections and excessive noise exposure. Some people are born with hearing loss, while others are affected gradually. Let's hear from Karen, who is deaf, about some of the interactions she's had and her thoughts on etiquette when you are communicating with someone who is deaf or hard of hearing, specifically on the topics of lip reading and shouting. We will also hear from Sean, a person who is hard of hearing.
So a few years ago, I bought my first plane ticket on my own. I'd flown a few times, but this was the first time that I bought my own ticket. I bought the ticket online and I was asked if I had a disability. I don't typically think of deafness as a disability, but I went ahead and put down that I was deaf. When I arrived at the airport, there were people there waiting for me with a sign that had my name on it, along with a wheelchair. Well, I don't need a wheelchair. All right. So then I got on the plane, and while they were doing the standard takeoff procedure, they gave me a copy of it in Braille. But I'm not blind. I can read. I just can't hear. So that was really frustrating for me at that time. Some people who are deaf can lip read. I can read lips, but it's not 100% perfect. Many people talk in different ways. The way they move their mouth differs from one person to another. It takes time to get used to how some people will talk. But you won't be able to catch everything that's said. If someone wants to interact with a person who is deaf through the use of lip reading, speak slowly, clearly, and make sure to enunciate your words. Gesture and use body language, that helps as well. If a person who can hear is meeting with a person who is deaf, I'd advise them not to yell. If that person already can't hear you, yelling at them won't help with anything. All it really technically does is allow other people to know that that person can't hear you. And by yelling, your frustration is emanating throughout the area. And now that conversation is not private anymore.
Impaired means damaged, and hard of hearing people are not damaged. They have most have their own culture. They know ASL. They can do everything that hearing people can do except hear well. So don't use that word.
Some ways you can get an individual who's deaf their attention is that you can tap them on the shoulder. You would like to do it easily. You don't want to tap them too hard. If you tap them really hard, they might assume that you're angry. So just tap them easily on the shoulder. Or you can wave within their line of vision, or you can flash the lights.
So let's talk about some ideas of respectful ways to interact with people who are deaf or hard of hearing. As Karen mentioned, if you want to get the attention of someone who is deaf, some acceptable ways you may want to try are to use a visual sign, such as a wave of your hand or a gentle tap on their desk. Some people prefer you just flick the light switch on and off. We suggest asking the individual what their preferred method is. Also, as Karen mentioned, there are a number of things to consider if the individual you are communicating with is lip reading. You will want to enunciate clearly, place yourself in ample lighting, and keep your mouth clear of obstructions such as bushy facial hair, tapping your pen to your mouth, chewing gum, or even looking down while you're talking. All of these things will make it much harder for the person to be able to read your lips. And again, remember not to shout. It's not always a volume issue for people who are deaf or hard of hearing. Some people may be totally deaf, while others simply do not hear certain tones. Increasing your volume will not help. Some people who are deaf are hard to understand when they speak. If you don't understand what the person is telling you, please don't pretend that you do. Ask for the person to repeat what they said. It is okay to say, "I'm sorry, but I'm having trouble understanding what you're telling me. Is there another way we can communicate this information?" Remember not to make assumptions about an individual's preferred method of communication. It's just as easy to ask the individual, what is the best way to communicate with you? Someone may prefer to text or simply write it down on a sheet of paper. Ask them for their preference. Sometimes people pretend to understand when they don't because they don't want to offend the person speaking. This could actually have the opposite effect because it could imply that you don't care enough to hear the message being conveyed. Sometimes a person who is deaf or hard of hearing may be accompanied by an interpreter. When this happens, you will still want to maintain your eye contact and direct the conversation to the individual, not the interpreter. The interpreter is there to simply transfer the information between you and the person who is deaf or hard of hearing. Do not engage the interpreter by saying something like, "Please tell her I said, how are you?" You do not have to worry about offending the interpreter by talking to the individual who is deaf. They are professionals and understand you should be looking at the person with whom you are communicating. Also, it is proper etiquette to ask the person who is deaf or hard of hearing where they would like the interpreter positioned. Consult the deaf person as to the best placement of the interpreter at a meeting to ensure they can visually see the information presented. And as you can see, the proper language to use is deaf or hard of hearing person instead of hearing impaired or the deaf. Like Sean described, the word impaired insinuates there is something wrong with the person. You may have noticed that throughout this presentation, we have mostly used person-first language, putting the person ahead of the disability. This is a little different with some disability groups, including the deaf community. Jill will be discussing why that is momentarily. Before she does, do we have any final questions from the Q&A box?
Thank you, Ron. We do have a few questions that have come in. First is, one of my candidates has disclosed a disability, legally blind, and the hiring manager would like to interview her. However, it would have to be a virtual video at this time. Are there any best practices or etiquette for this scenario I can share with the hiring manager?
This is a question that many employers are asking right now, and we do have some suggestions and some programs that work best for that. So I don't know those offhand, but I would be glad again to get you in touch with our worksite accessibility specialist who has some materials that might help you with that. So just leave your name and information or contact our office and we can get you those resources.
Great, thank you, Jill. The next one is a comment. It's not a question, but I will read this and see if either of you would like to address this. It says, my son is hard of hearing. When he does not hear well and requests the speaker to repeat themselves, he tells me it is frustrating when the speaker changes the sentence.
In this case, I guess that would be a personal preference, but I'm guessing that's because he wants to have the same information presented the same way. Perhaps he's reading lips and is kind of focusing on how that information is being presented. So I guess, again, that would have to depend on the individual and how they would like that information, reiterated.
Great, thank you. The next question, with masks now being required for us to wear in public due to the health crisis, how can doctors, employers, grocery stores, etc. get masks that can be used to help people with hearing impairment understand what they are saying?
Do you want me to take this one, Ron?
Sure.
So there are masks that are clear so that people can see your lips when you're speaking. And again, I am gonna refer to our worksite accessibility specialist who can probably provide you with information on where to get those types of masks.
Yes, and I happen to be the worksite accessibility specialist, so I do have access to some information on where those can be purchased. We also have some information on how those can be made, because with the pandemic, a lot of those providers are out of stock. So if you could leave your contact information, we can get that information to you. Another question. One of my candidates has disclosed they're deaf and wants a warehouse position. Could this present any possible safety issues?
This is a question we get frequently. Again, since the person has disclosed, you can talk to them about ideas they may have. If they happen to be enrolled in Opportunities for Ohioans with Disabilities, we can also be a part of that conversation. But in some cases, a lot of times things can be done with flashing lights. We've talked about people having a buddy system. There are different options. So again, with the fact that the individual has disclosed, that does open up the opportunity to have that discussion and get some ideas from that person as well.
Great, thank you. This next question, it sounds like you may be addressing this in the conclusion of the presentation, and if I'm incorrect, if you could address it now, that would be helpful. But the person is asking if you could restate the example about how to refer or not refer to an individual with hearing challenges.
Well, that will be covered here momentarily, so I don't want to steal Jill's thunder, so we'll hold off on that one.
Great. Let's see this next one coming in. I have a candidate who is deaf and used a translator for her phone interview. How do I communicate to the hiring manager to move forward with another virtual interview?
If you're saying, I'm not sure I understand the question. If you're saying with the hiring manager, are you able to disclose that to that person? I would ask the individual themselves beforehand.
Okay, great. Just scrolling through here to see if we have any left. If a person needs an interpreter on the job, does the employee or the employer pay for that?
I can take that one. Oh, sorry, Ron.
No, go right ahead.
So if it's somebody that's working with OOD, oftentimes we will provide an interpreter for that situation. But once it really is the responsibility of the employer if the person requests that accommodation. I just want to make sure that just because someone needs an interpreter, during a conversation like an interview doesn't mean that they'll necessarily need an interpreter on the job day to day. So there are other ways to communicate on the job, for example, texting or using a pad and pencil. But during trainings or those types of situations where there's going to be lengthy conversations, an interpreter would be the responsibility of the employer.
Great, thank you. Another question. I know that OOD sends job candidates to employers to help them fill open positions. What types of jobs can the candidates do, and what types of disabilities do they have?
Yeah, obviously, we as business relations specialists work with the employers to find candidates who are qualified that have disabilities. And the cool thing about our job is that the people that we work with when we're trying to place have all sorts of skill levels. We have people who, are looking for entry-level positions, and people have the skills, master's degree, whatever, to do more involved positions. So it's pretty much a wide range of people we represent, and their abilities are just as wide range in their backgrounds.
Great, thank you. Another question. With more and more people working remotely from home, how do you advise increasing accessibility awareness and promoting accessibility inclusion within the corporation?
The first thing that comes to my mind is educating yourself. So attending trainings like this to learn more about what is available. And again, reaching out to Julie. She has many resources that can help with those types of things.
Great, thank you. Was there anything else to add?
That's what I was going to ask Ron, if you had anything else to add to that.
I think you covered it. Reach out to the BRSs, and if it's not something that we can answer, we can bring Julie in, or we can talk to someone else in the organization to get you some ideas for that.
Great, thank you both. The next question. Sometimes a disability is not visible, or even the individual doesn't know, but exhibits some of the behaviors the presentation describes. How do you handle carefully such situations to avoid susceptibilities that affect the work environment?
I think you have to be careful that when you're addressing that you are addressing the behavior or the work performance, and not suggest that you think they have a specific disability. So in doing that, you avoid some I can't say the word, susceptibilities, but you also are still addressing the situation. And then if that person discloses they have a disability or decides to seek treatment, then you can talk about that at that point and what kinds of accommodations, if there are any, that would work.
Yeah, and I think, Jill, that you hit the nail on the head as far as, discuss the fact that the work performance may not be what it should be, and have a conversation about that. Jill mentioned if there's something that you notice, like they seem down or whatever, you can bring that up, kind of like in the scenario we presented, but you really want to wait till that person discloses before, talking about the issue itself.
Great, thank you both. Another question. Is this material only available for Ohioans? Or if the corporation is global, could we promote these training materials?
These are going to be available on our website. So the recordings will be on our website for any organization to access. If we're doing in-person presentations, which we typically do outside of the pandemic, that would be more specific to Ohio businesses.
Great, thank you. The next question. As a staffing agency, if our client cannot accommodate a disability, how should we address it with the candidate?
obviously this becomes a little more complex as the third party is involved. I think having a discussion with that individual who has the disability to see their comfort level of including, disclosing to the contracted company would be helpful. So they can be part of that solution and discussion.
I would also add, when somebody asks for an accommodation, it has to be a reasonable accommodation. So if it's really going to be a hardship on the organization to try to accommodate that person, that's acceptable. So, and again, if you need more specific information, please reach out to us.
Great, thank you. The next question. How do you handle communicating with someone who is hard of hearing while wearing a mask when they rely on reading lips and your expressions?
Yeah, I think we touched on this a little bit earlier. Julie, you mentioned you can help people get the masks that have the clear portion over the mouth. So that would be the way that if the person reads lips, you'd be able to do that.
There may be other forms of communication you can use as well.
Great, thank you. The next question. We have a person working for us that seems to be slow developmentally, and we have had some issues with other employees teasing him. What can we do to avoid this from happening?
Well, in this case, most companies, and I'm sure yours probably does, have personnel policies that have, show intolerance toward harassment or bullying. So this would certainly follow in line with that. In addition, your company can provide employees with education, such as the training we're doing right now, to help improve the comfort level with someone who has a disability. And of course, we have trainings like this that we put on throughout the year. We go, as Jill mentioned, before the pandemic, we would go to companies and do in-person disability awareness trainings, disability etiquette trainings. So that we are another resource for that as well, to help the other employees understand the importance of a diverse work environment and to appreciate the contributions of the employees there that may have a disability.
Great, thank you. I have one final question, if you have time. How can I ensure the company I work for makes the process for accommodations smooth and transparent?
Well, I would say, again, when talking about transparency, the key word there is communication. So when we're talking about accommodations, sitting down with the individual, again, they have to disclose that they have the disability, but talk to them about, the best way to implement and what types of accommodations would be necessary. The more communication you can have, the better.
Great, thank you both. That is it for questions.
Okay, thank you for those. Let's talk about the difference between people first language versus identity first language. People first language emphasizes the person, not the disability. So for example, you would say person with a disability versus disabled person. By placing the person first, the disability doesn't define the person. Generally speaking, this is the accepted way to refer to a person who has a disability. For people who prefer identity first language, the choice is really about empowerment. It says that the disability isn't something to be ashamed of. For example, deaf person, blind person, or autistic person, like we mentioned, or the questions mentioned earlier. If you're not sure which language to use, a safe bet is to ask the person what he or she prefers, or avoid using the disability altogether. Instead of saying my deaf coworker, just say my coworker. We're nearing the end of our time together, so I just want to touch on a few closing thoughts. We've talked about different types of disabilities, respectful interactions, and even heard directly from people with disabilities about their preferences and experiences. We hope that the information we talked about today helps you overcome any fears or misconceptions you may have about the best way to interact with people with disabilities. In short, people with disabilities are our colleagues, customers, stakeholders, friends, and family members, and want to be treated with the same respect you would afford anyone else. Remember, the person with the disability is your best resource. If you don't know what to do, just ask. Concentrate on the person's technical and professional knowledge, skills, abilities, experiences, and interests. And lastly, just relax and be natural.
Opportunities for Ohioans with Disabilities.